Good afternoon and welcome to Metropolitan Baptist Church's COVID-19 webinar, Returning to Worship in a Pandemic Environment. I am Servant B.J. Brooks, chairwoman of our host ministry today, the Metropolitan Diaconate, and we are excited to have this opportunity for a candid discussion about the status of the virus and what returning to worship in our sanctuaries will look like. We want to thank our pastor, Dr. Maurice Watson, for his faithfulness to the Metropolitan Baptist Church family, and we thank the Progressive National Baptist Convention Incorporated and the Conference of National Black Churches for their support of today's town hall. Tonight's webinar is live on Facebook, so remember to like and share. Our discussion will be moderated by Washington's and Metropolitan's own Jacquie Webb. A longtime member of Metropolitan, Jacquie has hosted gospel music programming on 96.3 FM WHUR since 1990. She currently hosts WHUR's Gospel Spirit program on Sunday mornings from 8 a.m. to 11 a.m. and the HUR at Home Inspiration multicast that is live streamed Sundays at 6 p.m. Eastern Time on YouTube and Facebook Live and on WHUR.com. And if that's not enough, Jacquie is also Vice President of Radio for the Corporation of Public Broadcasting, where she develops and implements strategies to strengthen the ability of America's public radio stations to create high-quality, multi-platform content to better serve their communities. If you know Jacquie, you know family and community are very important to her. We couldn't think of anyone better suited to host this afternoon's COVID-19 Town Hall, Returning to Worship in a Pandemic Environment. Hello, Jacquie.
Servant Brooks, God bless you. What a wonderful introduction. I am honored, I am humbled, and I am truly blessed to be here. Thank you so much. Hello, church family. Hello, everyone who has joined us today for this very, very important session. I know many of you were like me during Thanksgiving, all vaccinated up, even with a booster, able to get together with a few friends and family and enjoy the Thanksgiving holiday safely, social distancing. And the very next day after Thanksgiving, bam, Omicron, a new variant. It's like there's news every day about things happening around COVID-19. We have some very talented, educated, and in the know panelists today who are going to help us through all of this. And we invite you to ask questions. This is your opportunity to ask questions of the experts. If you're joining us on Zoom, please put your questions in the Q&A. If you're joining us on Facebook, put your questions in the chat. We will try to get to all of them. If we don't, if we run out of time, we will take note of the questions. And in a while, we will put the answers. We will go forth and try and get answers for you and put them on the Metropolitan website. Let's bring on our first guest. Dr. Ernest Carter has been health officer of the Prince George's County Health Department since 2019. He has been responsible for the design, implementation, and management of multiple grants and contracts from the Centers for Disease Control and Prevention. Dr. Carter has an AB degree in physics from Harvard College, an MD degree from Harvard Medical School, and a doctorate in bioengineering from the University of Pennsylvania. Welcome, Dr. Carter.
Good afternoon, and thank you. Thank you so much for that warm introduction. And thank you, community out there, my community, as the health officer in Prince George's County. I really appreciate what our citizens have done currently in terms of mitigating the risk from COVID. Our community has done an exceptional job. And the reason I say that is because our numbers in Prince George's County bear that out. Even though we had the highest case numbers in the state, our death rate actually was lower than the state average.
Wow.
And
Well,
which
we're
is
gonna
really
get into that, Dr. Carter. I want to bring on our other
okay.
guest.
So I just want to say thank you and thank you for having me.
My pleasure. Our pleasure. Dr. Tramaine Davis Rogers is the medical director for Family Health Services, and she's at the Prince George's County Health Department, and that's where she oversees immunizations. She graduated from Eastern High School and attended Tennessee State University in Nashville, where she graduated with a bachelor's degree in biology. She earned her medical degree from Meharry Medical College, also in Nashville, and completed her family and community medicine residency at Howard University Hospital. Welcome, Dr. Rogers.
Thank you. Thank you so much for having me.
Dr. Panagis Galiatsatos, who is also known as Dr. G, and forgive me for murdering your name, Dr. G. He is an assistant professor at the Johns Hopkins School of Medicine in the Division of Pulmonary and Critical Care Medicine. He is the co-chair of the Johns Hopkins Health Equity Steering Committee and co-director and co-founder of Medicine for the Greater Good. His critical responsibilities include working in the obstructive lung disease group at Johns Hopkins Medicine and in the post-COVID-19 acute clinic. Welcome, Dr. G.
It is a true honor to be here. Thank you so much.
Oh, and please say your name so that we can get it right.
No worries. And I'll be teaching everyone not only how to say my Greek name, but even those Greek letter variants tonight. So no worries. But Panagis Galiatsatos, Dr. G is perfectly fine.
It's beautiful. And thank you all for the work that you have been doing during this very critical time. Now, we have with us, representing Metropolitan Senior Servant, Reverend Dr. Maurice Watson this afternoon, is Reverend Dr. Jesse Wood, Metropolitan's executive pastor. Dr. Wood came to Metropolitan in 2004 as assistant to the pastor after pastoring the Love Zion Baptist Church in Columbus, Ohio for 18 years. More recently, he was appointed Metropolitan's executive pastor, where he manages the day-to-day church operations and oversees the more than 30 church ministries and the ministerial staff. Dr. Wood, good to see you again.
Thank you, Jackie. Good to see you as well. And it's certainly good to be here and to be a part of this panelist.
This is so important. We get so much information. Sometimes we get misinformation and disinformation. But with the help of you all, we will be able to get some vital and accurate information about what's going on with COVID-19. And once again, if you're on Facebook, please put your questions in the chat. And we want you to put your questions, those of you who are watching us on Zoom, in the Q&A. Dr. G, what is the latest information we have on this Omicron variant?
Yeah, no, so great question. And this gets asked often. So we'll take a step back real quick. Every time the virus enters a human being and leaves, it always mutates. To put it in other context, whenever we give birth to a child, to our genetic friends or geneticists, it's technically a mutation. Still a human, it's just different from its mother and father. So whenever a virus leaves the human beings, it is different than when it entered, slight mutations. If any of those mutations make it easier to transmit or potentially more lethal, we call it a variant. And as opposed to using letters and numbers, we opted to use the Greek letters. So we're up to Omicron now. What we know and what's frightened us is that the mutations it has made may make it more transmissible, meaning easier to spread from one person to another. But at this moment still, going back to that analogy of having a child, if you have a child, you don't really know its potential until years later. Like, okay, did it achieve greatness and so forth. So right now, this virus is still too early to know exactly what it will do to us. From some studies out of Israel, it looks like it does spread easier, but the vaccine that we currently still have looks like it'll be effective against it. So more to come, but that's the latest news.
That's good news that the vaccine will probably work against this
Yep.
variant. Dr. Carter, in the news recently was that Maryland was one of the states where the Omicron variant was discovered in a patient. Is that in Prince George's County? And I want you to continue to tell us what you were talking about earlier about the status of the virus in Prince George's County.
Well, as you can tell from when I first came on, I'm excited about being here. I'm really excited about telling folks about where we are in Prince George's County and how we are going to overcome the Omicron virus and any other virus that comes down the pike or any other mutation. Because when we put in the right mitigation measures, follow the science, we tend to do better. We do actually do very well. So here in Prince George's County, the Omicron virus hasn't come here yet, but you can expect it probably in this week or maybe in the next week. It's going to be here. We know that. And that's one of the reasons that we maintain our mask mandate for indoors, is that we knew that with the virus like the COVID virus, in the wintertime, it tends to go up. And with Omicron, which being a little bit more contagious, as it seems, as Dr. G said, as it's been shown in Israel, we know that we're going to have to maintain that through this time period. But we're not overly concerned about the virus, because as I said, if we follow those mitigation strategies that we've been doing, keeping the mask on, remaining 6 feet, making sure our surfaces are clean, and just being completely aware that we're still in the throes of this. Although we're doing better and we're starting to understand better, there's a lot not known about this particular mutation, this particular variant, but we know that there are going to be others. But now that we're aware, we're not caught by surprise, I think we're going to be able to handle it just fine.
Good news once again. Dr. Rogers, Christmas is coming up and families want to get together again. And so what else can we do to make sure that we are keeping our children and our elders safe once we all get together again for Christmas?
So, I mean, number one, like Dr. G and Dr. Carter stated, being vaccinated is number one on the list. So the vaccines available now through Pfizer are for children basically 5 and up. So if you choose to have your child vaccinated, that's one way that you're going to reduce the risk of passing on this virus. Small groups are always recommended. They say 15 or less, but the or less would keep you at a safer distance from catching that virus as well. But like Dr. Carter says, wear your masks, wash your hands, be mindful of where you are and what you're doing. If you have elderly individuals at home, or even younger siblings at home who can't get vaccinated, or for some reason they have underlying medical conditions, you want to be very careful around them and keep, as safe as possible when you're around them.
Good advice. Good advice. Dr. Wood, I've heard all kinds of ways that the COVID-19 situation has changed the way churches have been operating. I've heard of churches that have actually hired new ministers to do their digital and online church as a parallel to what's going on in the sanctuary. So there are many ways that the COVID-19 era has changed churches. What are you seeing?
Well, one, Jacquie, it certainly has forced us to be creative and to give God an opportunity to work differently beyond what we consider to be traditional worship. And so in that regard, as so many churches have done, we've gone to virtual worship, and there are many pluses to that. In fact, what it does, it gives one an opportunity to worship at various times on any given day, and especially since Sunday is our day of worship. In our case, for an example, we still have our 7:30 and 10 o'clock worship service. We also have a 1 o'clock Zoom service, but all that is already pre-recorded. And but it gives us an opportunity to share all that information, not just locally, but also really throughout the world. We have persons who tune in from all parts of the world, and not just, the country in which we live. And so in that sense, I think it's been extremely positive. It also, as I mentioned earlier, it really has forced us, and I say that in a very positive way, it has forced us to really see worship and see the opportunity to touch lives differently. Our Sunday school numbers are up, our meetings numbers are up, and it poses some challenges, and especially for our music ministry, you've got to figure out ways to make that work. But when it's all said and done, and it comes out, I think everybody's pleased, with the final production. But I think the bottom line is that it really has given us to know that you can't put God in a box, and you can't box him in at 10 o'clock, 11 o'clock, on a Sunday morning or any given day. Much bigger and broader than that. And so it has forced us then to say, how can we spread this word in a meaningful way, but in ways perhaps that we've never considered before?
That is so true. COVID-19 has definitely taught us that the church is more than a building.
Yes, absolutely.
The community of worship. So there are still people, just, in Maryland, I think we're good in this respect, as far as not having a whole lot of people that still have vaccine hesitancy. But a lot of people are still holding back. They don't understand what it does, or maybe they heard something that wasn't true about the vaccines. So maybe we can shed some light on how the vaccine actually works. Dr. G, can you tell us, give us an idea of when you get the vaccination shot, what happens?
Yeah, I'm actually going to take it a little bit back too. So, I always get these questions, from a lot of people who are hesitant about the vaccine. Like, can I just make my immune system strong? Can I just make it strong? What can I do? What vitamins to take to make it strong? And I go, look, what if your Baltimore Ravens or Washington football team showed up Sunday, a week of training in the gym, got strong, but had no idea who they were playing on a Sunday? They wouldn't win. They'd probably lose. Your immune system being strong does not replace it from being smart. A smart immune system will always beat the infection. And the best way to make it smart is through the vaccine. The vaccine gives us a playbook, right? It'd be like the Ravens or the football team reading the playbook on their enemy. That's what we can do. As human beings, we've known how to create immunity, right? That immune memory without ever having to succumb to a disease. And that's what the vaccine does. It gives your immune system a playbook. So if we see this virus, it'll know how to take care of it. You may get a mild case of a cold from it, but it won't get hospitalized and you won't die from it. And that's how we win. That's how we end the pandemic. So what the vaccine does, makes our immune systems smart.
Wow. There's also a lot of talk about the COVID-19 pill. Does anybody want to help us out with that? What is it and how does that work? And is it for everybody? Dr. Carter, can you tell us about the COVID-19 pill?
You mean there are antivirals that are effective against the COVID virus, and they have different effectiveness. And the most, and that was an important breakthrough. I mean, it wasn't announced as important, but it is another tool that we have. It's another weapon we have against the virus. If in most of the antivirals are such that if you give them within the window of time that they are effective, they work fairly well. And then of course, we also have monoclonal antibodies. It's not clear if this particular variant that monoclonal antibodies work as well against this variant. And I know Dr. G can say a whole lot more about this because he's practicing right now. But we do have medicines that do work, that have a lot of promise. But I'll hand it over to him because I know he can expound on that a lot more.
Yeah. No, thank you, Dr. Carter. But I'm going to just pick up from you. You're right. I mean, we're getting a lot of tools in the toolkit to beat this virus, right? The vaccine, remember, keeps those antibodies making our immune system smart for months to months, right? So that's a great take home. The pills are the two medications, one from Merck and one from Pfizer. Yeah, these would likely be game changers too, because the intention is to keep you safe, keep you out of the hospital, keep you from passing away. Merck's is likely to be approved in the next few weeks. And then Pfizer's is unique because it's just a repurposed medication, meaning it's ritonavir. That's an antiviral for HIV that we realize will likely be working and works well from the research against this coronavirus. So having these two as well, part of the toolkit, it's great, it's exceptional. And from my standpoint, it will just hopefully continue to convert this COVID-19 into nothing more than a mere cold. So, so more to come, but, we're very excited with these breakthroughs.
Dr. Rogers, just recently, there was a news report about children in Prince George's County getting doses of the vaccine that were expired or something like that. Is there a way that parents can make sure that what the children are getting is the right vaccine?
Right. And I mean, that was an unfortunate incident. And there are more children getting vaccinated, I just want to say, with the correct vaccine, non-expired doses. But, we're human. When we go to these vaccine clinics, the staff, they're trained, they understand, and they will check those vials and make sure that what your child is getting is not an expired dose. Feel free to ask. They will have it in front of you. There's no harm in asking, but I just want everyone to be calm and understand that's just a very, very, very rare occurrence. It's not something that we see all the time. And that, the staff that are there, the nurses and the volunteers that are there, they're trained to make sure that you're getting exactly that unexpired full dose of the vaccine.
That's right. Everybody be calm. I was worried about that when the news came out about that they would discourage people from having their children vaccinated. Dr. Carter, if someone has pre-existing conditions, do they need to be concerned about getting the vaccine? Is there any cases about that?
I think they should be concerned to get the vaccine. If they have pre-existing conditions, they need to be protected, because people with pre-existing conditions are much more vulnerable and susceptible to some of the complications of the virus. And so they are particularly vulnerable and they should be vaccinated. The vaccine is safe. It doesn't have any particular degree of severity within a person who has a existing condition or not. It's just fine. Occasionally, though, you do get a complication from the virus. And those complications, for the overwhelming most part, is a sore arm, or there are people who have allergic reactions to the ingredients within the vaccine. And occasionally you'll get there are some children, and a very, very few, who've had a myocarditis from the vaccine that has been transient. But for the most part, this is one of the safest vaccines that has probably ever been made, because there's so many people who've been vaccinated throughout the world, and we have been able to see that the safety is just remarkable. So people who have pre-existing conditions should not worry at all and be sure they get vaccinated.
Thank you. Dr. G, I want to go and visit some of your relatives in Greece one day. What about international and domestic travel? What do we have to be concerned about as far as traveling nowadays in this COVID-19 atmosphere?
So I love this question because, we've learned a lot about COVID, right? COVID-19, 2019, we're 2 years into it. And I say this because right now, knowing that COVID-19 is a preventable disease, right? We can prevent getting it. And even regardless of all the variants that may come of it, the biology of it still doesn't change. We know it's an airborne virus, that someone's got to breathe it out and you have to breathe it in close proximity for a period of time. We have all the right weapons that we need to keep ourselves safe and allow us to kind of enjoy life without catching COVID. My analogy here is often like wearing a bike helmet. Gravity's still there, it may pull you down, but if I wear my helmet, I won't get a bad brain injury, but wearing the helmet also allows me to enjoy riding the bike. So we have the tools to not catch COVID. We've got the face masks, you got the vaccines to keep you protected as well. keep a close eye on your surroundings as well, right? So if lines look tight, be like, oh, maybe, ask some people to space out. So I say all this because I do think you can do these travels safely. From my standpoint, my biggest concern that I raise to any travelers, especially my own patients, is you just got to be aware of your surroundings. That's it. Wear your face masks at all time, keep your hands clean, and just be aware of your surroundings. If someone gets too close to you, just, ask them politely to back away, try to maintain your space as much as possible. So I do think travel can be done safely. It doesn't eliminate your risk, but you can be safe. You can go and travel without catching COVID-19. And plenty of people have demonstrated that countless times throughout, the 2 years a pandemic has been. I mean, to date, I still haven't seen a plane specifically, for instance, be the source of a super spreading event. Really, those super spreading events tend to happen, say, in an indoor dining area like a restaurant and so forth. So I think as long as people are cautious throughout their time, they can do this safely.
Amen. Dr. Wood, how can we, as a church community and as a community at large, try and counter the way people tend to make wearing masks and getting the vaccine political issues? Is there something we can do to kind of calm that storm?
Well, that's a loaded question that I really wish I had the perfect answer for. I just think, Jacquie, that that we have to at least be instruments from the church standpoint. We have to be willing instruments, and what I mean by that is we have to be willing to wear the mask. We have to be willing to get those vaccinations, and we have to be willing to spread that word and to share that word. I don't know how you change minds and you change hearts. I've been surprised at individuals that I never thought would not be vaccinated. And so I understand that it is very much a very personal decision that one has to make. But I think that when we look at the number of deaths, we look at the number of individuals in our congregations who have experienced sickness. When you look at all of this, for me, it pushes the envelope, it pushes the button for me to share this word and to encourage people to do the right thing. And I just think that if we can push it within our families, and we ask our ministry leaders to push it among the members of the congregation to whom they serve. But again, you can't make people do. But I think if we can be an instrument, then hopefully we can represent what we believe in the church community, really God is calling us to do.
Thank you, Dr. Wood. I once again invite everyone who has a question, please, if you're on Facebook, put it in the chat. If you are joining us on Zoom, put it in the Q&A. We have a question that I'd like anyone of the panelists who wants to take it to answer. Will another shot be needed even after you receive the booster?
May I jump in this one first, and then others? So there's something that my colleagues kind of shared that I thought was really good to know. The booster that we're talking about with that third shot, I know we're calling it a booster, I get it, for the general population, but really what has been really enlightening to me is this vaccine from Pfizer, Moderna, all of along should have probably been a 3-series vaccine at 0 months, at 1 month, and then again at 6 months. The reason why they put out what we had at the 2-shot was because we're in a pandemic, right? We're moving at a different pace. We didn't have time to wait for that additional one. But this parallels kind of like the hepatitis B vaccine shot, where it's 3 spaced out accordingly. So I say this because I know we're calling it a booster, but why I'm saying this might be, the third shot might be the necessity for a complete series, is potentially it may be all we may need. We'll see. Time will tell with new variants and so forth. But a lot of my colleagues made a great case to say, we don't know yet, right? So it's still early, but some of them are very optimistic that the third is a complete series of this for coronaviruses and may be all we need. With that said, time will tell. So there's potential, I think, for both maybe all we need, and maybe we may need more. But I wanted to bring that up, that the booster really for many people, they thought of it as a completion of a series of vaccines.
Wow. Dr. Carter, Dr. Rogers, want to add anything?
I absolutely agree. That's, you know, that's our intuitive feeling as practitioners. We know that the vaccine came in the order that it did, but my intuitive feel is that it wasn't a complete series. That this is complete. That the third shot probably is the completion of the series. And Dr. G said, I'm just repeating what he said. Time will tell, because we just haven't had enough time to tell. The good news is that even when the Omicron virus shows up, we kind of intuitively know our vaccine is probably going to be effective against it, because because these variants occur like that. So I think I don't want the public to be overly worried about getting, are we going to have to get a vaccine constantly, because of X, Y, and Z. I think that's an excellent point that Dr. G made.
Dr. Rogers, anything to add?
No, I don't have anything to add. That was perfectly stated.
Well, I'll throw this out to the group. From what you've seen, what are the effects of what they call long-term COVID? We've been reading that there are after effects. Can you talk a bit about that? I'll start with Dr. G.
Right, so I'll share, there's three things when we see patients. So we have a post-COVID-19 clinics, and really the symptoms that patients feel fall usually into one of three categories. Sometimes they're just symptoms of healing. And what I mean by that is, again, imagine if your leg broke and you're in a cast, and then we take the cast off, you're gonna be in a lot of pain as you get that leg to work again. It's the same thing with your lungs. They were ravaged, and as it heals, you're still gonna feel a lot of symptoms. So we try to identify, could these symptoms just be part of healing? That may take some time. Two, sometimes patients may have an underlying disease that they were compensating for such a long time. COVID came and you lost that compensation. So suddenly, yes, we're diagnosing you with asthma or some other level of a disease. And so we try to pick up on that. And then finally is that last category. This is the most humbling one. This is the one where, yeah, we do think that you've developed some unique disease, a post-COVID-19 long-term syndrome that we're learning in real time. That's where our patients become our teachers, because I didn't read about this in medical school. So we're learning with them. And that's unique in of itself. It does, we're starting to see some level of treatments come out for it. But I can tell you the biggest symptom of it is fatigue. And when I say fatigue, we've all felt that. But think about a fatigue where you feel like, and this is a quote from my patient, 150-pound anchor constantly weighing you down every day. That's how they feel. So those are the three categories most patients fit into. We're learning a lot about this. And, as I said, the last category is the most humbling. My patients become my teachers in real time.
Wow. I was reading about Smokey Robinson, the legendary R&B singer from Motown, who contracted COVID-19 and almost died. But he said that his doctor told him that he survived because he was in good physical shape. Dr. Carter, could it be that in the early days of COVID-19, we saw so many deaths in the African-American community because of our initial health?
I think that's a reasonable assumption. And there are probably other factors, but a reasonable assumption is that, and for instance, in Prince George's County, we have a significant number of people who have cardiovascular disease, who have obesity, who have diabetes, have renal disease. So yes, I think that can be said. And what we want to do, and because I can have a little commercial about public health, you really do have to maintain your health. You need to know your numbers. You need to know your cholesterol count. You need to know what your blood pressure is. You need to know what your blood sugar is. You need to eat healthy. Eating healthy is not a bad word. And eating healthy doesn't mean you're not eating good. So you need to eat healthy and know what that means. We're not going to go into it today, but eat healthy. You got to exercise. Get sleep. Sleep is really important. It's a healing factor. You need to get sleep. And important in our community, you've got to reduce your stress. And there's a lot of behavioral health issues that have come because of COVID. And it's because we've been inside and a lot of other things. But stress is significant in our community. And the other thing that's important is you have to be sure you have spiritual healing. And I will let Dr. Woods go into that in depth, but that is, you have to have that. You have to have all components to be healthy. So I'm going to be through with my commercial and hand it over to somebody else, but thank you for that.
Let Dr. Woods follow up about spiritual health.
Well, you know, one of the things for sure is that this is a test of one's faith. And I say that because faith is not what one can see. If you know the results and you can anticipate the results, then you really don't need faith. But faith says that I don't know what the outcome is going to be. I don't know what kind of challenges I'm going to face along the way. But my faith says that there's a power greater than myself that is able to see me through those challenges. So I have to believe that, and I have to trust that. And in trusting that, then my faith also says that I must trust the vessels that God infuses with wisdom and discernment to help us to have an appreciation and an understanding for how we live this faith out. And so I use this as an example. This is maybe, I don't know if this is really a good example or not, but I think so often about the this whole vaccination process. And I've traveled with many folk who travel with me to various places out of this country, South Africa, Australia, and they tell us, well, you can't enter the country or you can't get on the plane without being vaccinated, without getting a shot. We don't question it. We go and we pay money for it and we take the shot and we do what we have to do. This is life-saving, and yet still many folk will question it. But I think the faith issue says that if I can trust God to deliver me and see me through the challenges of life where there is no pandemic, then I can certainly trust God to see me through the challenges of life where there is a pandemic.
All right now. Deborah asks, my daughter has taken 2 shots. She is 12. This month is her 6th month from her 2nd shot. Should she get the 3rd shot now? That's a question. Does anybody want to take that?
Well, I'll take it out she's 12 years old.
12 years old.
So she doesn't need the 3rd shot right now. Okay. I want to be sure, and I'm going to be very clear about being sure you talk it over with your pediatrician. Your pediatrician is very important in this scenario. Each child, and when pediatricians follow children, it's important that child is being followed by a pediatrician, and they know what that child is, when to do X, to do the right thing for that child. And there's a lot in that, but I really want to be sure that when you get that type of advice, please get it from your pediatrician, because especially for your children, because as we go through this pandemic, and just like what we just discovered, like Dr. G said, we sort of get the intuitive feel like for the adults that this 3rd shot was a necessary shot and was probably what we should have. The children, we just started vaccinating children. So that's why I want to be cautious. we're going to follow what the CDC says and what the advisory committee for infectious disease practices say, and we're going to take it in that order. So I think I'm going to just leave it there.
Okay. We heard an awful lot in the beginning of the COVID-19 experience we've had in the last 2 years. People began saying that it's not for the young, only the old get this disease and they die from it. If the young get it, they'll survive. And then during the 2nd year of COVID-19 experience, we heard an awful lot about children dying from COVID-19. And I'll turn this over to Dr. Rogers. Did something happen? Was it a mutation, or has it always been the same that children have been affected the same way, or did it just get stronger? Why in the latter part of this COVID-19 era did we start hearing an awful lot about children dying?
I think, and then other panelists can correct me, is that the children were always being infected with COVID. The same strains that were infecting adults were infecting children. The adults have more pre-existing conditions, and they were falling ill at a faster rate than the children were. But children, they got very sick from COVID, just like adults. They had the same short-term sequelae and long-term sequelae that the adults have from COVID as well. And what we also heard was children don't spread it. And we now realize that that's not the case also. So they spread COVID just like the adults did. I think in the beginning, because it was new, we didn't know exactly what was going on. What we were seeing were the rates at which adults were becoming infected and the rates at which they were dying, unfortunately. And just to know, children, their rates weren't as high, but they were being infected as well.
And just to add to Dr. Rogers as well, the other thing was just social, right? Schools locked down. I remember my daughter stayed in their own little bubble. Now schools have reopened, right? So you're allowing a lot more child interaction. So I agree with the rest, and just keep that in mind as well as one more thing. So, but I will also say, just to all of this, every life that's lost. I mean, that regardless of which age group, like we're a community, we care for everyone regardless of age. So, I hope we drive on that moral principle.
Dr. G, can pets spread the virus?
So all right, one other Greek term you guys will learn today, and it's because it's a principle of this virus, and actually for the last probably 60 plus years, a lot of these viruses have this thing in common. They're called zoonotic. The first three letters are ZOO, means it's like zoo, but it's Greek for meaning just animal. So the last few decades, all these viruses that came out that created public health crises were zoonotic. HIV began in another animal, Ebola in another animal, flu, et cetera, then mutated, leaped over, came to us. That always caught our immune systems off guard. The other side to it is the anthropozoonotic, meaning can humans pass it to animals once we have? And the answer is yes. Our veterinarian friends have had cases of cats and dogs getting COVID. So always put that out there to, if you're quarantining, you should always do it from your animals as well. So we can spread it to animals. And we saw also a big one in a farm in Denmark a few months back. But once we get it to animals, I don't know if it can leak back to us. I don't know if that science is out there, but we can pass it to other mammals. That has been identified.
Wow, didn't know that. Question from Dorothy, and Dr. Rogers, you may have answered this already and maybe Dorothy didn't hear, but she says, as a loved one of one of the 70 children given the expired vaccine and will now get the correct type, what should we be observant of as a consequence of getting the extra in a short period of time?
So just to look out for in particular, I think that was the first part of the question. Are you asking, like, if she receives an extra dose, is there a problem with her receiving the extra dose?
So it said, she writes, the child is now going to get the correct type. Mm-hmm. The question is, what should we be observant of mm-hmm. as a consequence of getting the extra mm-hmm. in a short period of time?
So I nothing. I don't think, and I'm almost certain that there's, outside of the normal vaccine, things like a sore arm, maybe some slight fever, some mild fever, anything like that, but receiving the extra dose of the vaccine will cause that child no harm. there's no harm in her receiving that extra dose.
Here's another question. Is the vaccination safe for those childbearing women who may be high risk due to age, high blood pressure, etc.?
It is recommended, especially for those women, childbearing, non-childbearing, but pregnant women have been receiving this vaccine, and pregnant women actually fall into this category of being high risk. So we've seen a lot of pregnant women who catch COVID and they have preterm births. They end up in the ICU. They have a lot of major issues from COVID. So being pregnant or wanting to become pregnant or being in this pre-pregnant age range, if they say maybe that 20 to 35 or 25 to 45 age group, is recommended, highly recommended, that you get this vaccine. Everyone.
Excellent. Are there any other rumors out there, misinformation that we can totally debunk right now and say it's just not true? You know, I heard a story on NPR about they followed a nurse who was trying to give vaccinations to people, and she had to go around with a magnet to prove to people that the vaccination does not make you magnetic. Are there any other things we can tell people that's just not true?
I'll throw one thing out there because it's frustrating because it keeps getting twisted when people were like, oh, they were vaccinated and they still got COVID. Right. The vaccine's job is not to prevent you from getting COVID, no different than wearing a helmet is to prevent you from falling. Gravity's still going to be there, right? The vaccine's job is to keep you safe. So if you do get COVID, it'll be a mild case. You won't be hospitalized. You won't die. Right? If we make this sinister virus into nothing more than a common cold, we won. And so just recognize that, you know, and I say this because it's misinformation or misperception that really goes out there tons. And I see that countless times, you know, so that's it. At the end of the day, the vaccine's job is to keep you safe out of the hospital and from passing away. That's it.
Micheline asks, will people who got the J&J shot and a booster need a third shot? If so, when?
Well, they haven't determined that right now. So what we do, and I want to be clear about how public health does this, we follow the FDA's procedure. We make sure that when a booster gets approved, it goes through the FDA, it goes through the what they call an ACIP, that advisory committee. And once the advisory committee and everybody says the booster is approved, that means the clinical trials were done and to prove its efficacy and that it doesn't have the side effects, et cetera. Then the CDC approves it, and then we say yes. But prior to that, I don't predict when a booster will come, because it's you know, the media talks about it and everybody speculates. But from our perspective, we wait until it's official, and then we say yes, because sometimes something will happen that they'll find, that ACIP will find and say, well, we're not going to move ahead on this. And so that's why I want to be sure that when I don't speculate on that, because I'm the health officer, and we generally don't speculate on the timing of when something will happen like that.
Can I, Dr. Carter, did you have something to say about misinformation? Because I saw you hit the unmute, and I was curious to see if you were going to say something.
No, I was just going to say something very general, like the internet is filled with misinformation. Just about everything you see on the internet that doesn't say what we just said is misinformation. And so it's an amazing amount. I'm always just floored by the amount of misinformation, and that people will believe just about anybody who comes on who may not have any basis for what they're saying, and they believe them. And so I don't honestly know how to overcome it, but I think what you all are doing here is wonderful, because it helps to inform people about, you know, what is the truth about this. And one of the things is that every doctor on this panel and the Reverend and all of us, our job is, we don't have any reason to say what we're saying, what we're saying, other than that we want people to live and we want people to be healthy. That's our only concern.
Mhm.
We wouldn't be here if we didn't want that. So I was just, thank you, Dr. G, but that's all I was saying. I was just moved that that's one of the biggest barriers that as a public health official I have is all the misinformation that's on the internet.
Yeah, it's amazing. I was listening to new journalists talking about they were actually prepared to cover in the news a pandemic type situation, but what they weren't really prepared for was all the mis and disinformation going around. It's amazing. Now, getting to Metropolitan Baptist Church, Dr. Wood,
All right.
I wanted to know about Metropolitan's plan over the next few years in this pandemic situation. I understand that Metropolitan actually did a survey of the congregants. Can you share some information about that survey with us?
Sure. Well, Jacquie, first of all, I certainly hope and pray and trust that it won't be several years. All right. Our hope is that somewhere in the near future, that we'll be able to return to some form of in-person worship. But we wanted to certainly do due diligence to our efforts and to make sure to the greatest extent possible that we involved as many of our members as possible, as we considered going back into in-person worship. So one of the questions we asked, as you will see on the screen, is what kind of worship do you prefer? And you'll note that the greater number of persons, some 74% of those individuals who responded indicated that they would prefer in-person worship. And that's a good thing, because it does not mean, however, that once we return to in-person worship, that we will not continue doing virtual worship. And in fact, there's this whole concept of a hybrid worship experience is what you really can expect. We haven't figured it all out yet, but it is our intent that while we are yet in person in worship, that we will be conveying that same message virtually to those who are unable to physically return to the building. So that's the first question that was raised. Another one that was raised is, will you be returning back to Metropolitan when the church reopens? And once again, as you see in the responses, some 90% indicated yes. Now, what you don't see in that question, there was a follow-up question that kind of asked when, and we gave some options, and there was a large number who indicated a willingness to return somewhere in the last quarter of this year, like October to December, and then there was a larger group that looked at January to March. And in all reality, we probably are more in that particular category of the January to March. Again, we have not worked the particulars out. It is our hope that we might be able to return to some form of in-person worship yet in the month of January. And that is our intent if all things continue to be steady and moving forward in a positive way as they are right now. Another question that was also raised was which of the following conditions do you agree should be present when we return? And we asked persons, of course, to check those answers. And all of these are significant and important. In fact, 40% responded by saying all of the above. And all the above includes things such as maintaining 6-foot distancing, checking one's temperature upon entering the building, mandatory mask wearing, and also being fully vaccinated. And we will, in fact, be intending to implement every aspect of that as we return to in-person worship. We have a church reentry task force made up of some of our key leaders, some 10 to 15 individuals who sit and discuss these items and try to figure out not only when, but the best way to return. And certainly this helps us as we consider just what the protocols will be for us upon our return. And you certainly can expect these items to be part of that protocol. And then I think the last question, at least that we're sharing today, is the question, are you fully vaccinated? That really is the key question in order to return. We have established our position that in order to return to in-person worship, one must be fully vaccinated. Now, we have given some options, excuse me, if you will, that if a person has a medical reason why they're unable to be fully vaccinated, we do ask them to provide evidence of that from their doctor. And also, if they provide, even though they may provide that evidence and they have not been fully vaccinated, we have asked that they will need to provide us a negative COVID test within 3 days of the date upon their entry. And so our aim in all of this is to put forth our best effort in making sure that we keep everybody as safe and healthy as we possibly can. So these are just 4 of the questions that were asked, but very prevalent to moving towards reentry.
That's wonderful. That's wonderful. A vision and a plan. And I'm sure it'll be fluid depending on the situations day to day that we are monitoring. We have more questions. So let's see if we can get them all in.
Can I say one thing to Dr. Woods?
Certainly.
The health department in Prince George's County is here to help you with getting back to in-person worship. We've been thinking through this, for a while. We understand the trends, and and right now, as you know, it's rising and it's going to rise, and you've got Omicron and all that. But we will help you get back to in-person worship, and we will give you at least some guidelines to follow that will help. So, because I know that we're going to do this for all who need that with respect to getting back to when you can come back and to safely come back and congregate. And so I just want to be sure I put that out there. That's really part of our job to do.
Great.
And to be sure that we help you with that guideline. We work very well with our churches, and I want to be sure that you know that you have that resource.
Great. We appreciate that so much, Dr. Carter. And I didn't enumerate the various things that we either have done or will be doing prior to in-person worship, but we have taken a number of steps that I can certainly articulate before we conclude today, and that will give our members and others at least an understanding that we're not just sitting idly by hoping and wishing. We are doing some things to make sure that we cover all of the bases in preventing anyone from entering our building under any kind of condition, but a safe, sanitary environment.
You can go right ahead if you want to talk more about that, Dr. Wood.
Sure. I'll certainly will share a few things. We've already talked about some of the protocols as have been introduced, already in the survey. We have made several investments, if you will, in equipment, and we've also have hired some staff persons or contracted with certain staff persons just to make sure that, again, we're able to fully implement our plans and to keep everyone safe. So, for an example, just about 2 weeks ago, I think it would have been, we actually did an in-person installation of officers. And that would have been the first time since the 8th day of March in 2020 that we had that many people back in our sanctuary. And one of the things that they noticed when they came in, and this was kind of the protocol we established, is that when they came through the door, there was a temperature taking machine. The first thing we did was to take their temperature. Not only did it take their temperature, it also took their picture. And so we at least are able to put the photo with the temperature gauge that was taken. And then as they enter into the building, there were stations set aside for contact tracing. We have a contact tracing form that every person is expected to complete with certain very basic questions that make sure, once again, that they have done due diligence on their part to come into the building safely. If the answer is yes to any of the questions that were raised, then we say to them, I'm sorry. Take it from the heart and not from the head, or whichever way that goes. We don't mean you any harm, but for everybody's safety, you can enter today. We also made sure we had masks available. We have hand sanitizer machines throughout the entire building, sanctuary and hallways, and et cetera. We also have sanitizing equipment where we literally go in and we disinfect all of our seats, we disinfect the airspace, and it takes us about 45 minutes to an hour to do that. And so we've done all of that, again, to keep folks safe. We have changed all of our faucets in our restrooms to hands off, for lack of a better term. All you got to do is stick your hand under and the water will flow. Again, we're trying to mitigate against this thing, and we're doing everything in our power to make that happen. We even have foot sanitation pads. So when you walk through the door, you come in and we sanitize the bottom of your shoe. And because we want to make sure that if you're carrying anything on it that's going to impact someone's health, we're going to do our best to work against that. Those are the kinds of things, that we have done and that we have put in place. One other aspect, we have even obtained singing masks, because once we return to in-person worship, we know we will not go back immediately to any form of congregational singing, but we will entertain, our praise team, some anywhere from some 5 to 8 individuals, or 5 to 10 in the ballpark. Each one will wear a singing mask, a mask that has been specifically designed for one who sings. So it lets you sing without spraying everybody and even the person next to you. And it also lets you do that without impacting the quality of your voice. And so those are the things that we have done. And we feel pretty good about being ready when we actually give the word. And hopefully that will be soon.
It sounds like we're ready, Dr. Wood. Dr. Carter, is there anything else they should be thinking about?
They're thinking about more than that. No, that's wonderful, Dr. Woods. It's music to our ears, and the other thing that I was saying that we could help you with is predicting when you might open, with respect to how it's spreading and the infection rates and the case rates and those kind of things. So that's the epidemiology that we follow on a daily basis. And, we can sort of predict with reasonable assurance, like that in the next week or so, you might be able to open, because we're looking at what trends, X, Y, and Z trends. So those are what we can really, really help you with, think through, and hopefully, and I'm knocking on all kind of wood, that once this rise and fall happens from the winter months, like we should get to a point where we have a vaccination rate here in Prince George's County that is steadily increasing. I'm impressed with your congregational vaccination rate at 96%. That is the music to our ears. So we know that you all are doing everything possible. And so I think we could work with you to give you a reasonable time frame to think about reopening.
Okay. And I might also mention, which I didn't mention earlier, one of the things as well is we have designated, in order to maintain and practice 6-foot distancing, we have designated seats in our sanctuary. Unfortunately, obviously, when we return, it's not our intent to be able to return at full capacity. We think that's a challenge that we're not ready to face. But we have done due diligence in terms of the 6-foot safe distancing. We've done that in terms of we know exactly what seats are available and where people will be able to sit. And we think we're safe in that regard.
Thank you very much. I'm going to try and fit in as many questions as I can before we have to close. One big question that keeps coming up is mixing vaccines. Is that safe to do? J&J with the Moderna with the Pfizer. Is that okay?
I'm going to do my best to try to sound like Dr. Carter, where we try to stick with the data that gets put out there. There was a good paper done by really amazing scientists in the world of virology that did show mixing and matching was fine and safe. And I've gone into communities like this in more rural areas. The last one was the Jacquie tribe in Montana, Rocky Boy, Montana, where they had to mix and match because the supply that got them the first time couldn't come the second time. So they had to do J&J for their booster shots. So what I love about the study that came out weeks ago, everything feels like weeks ago, it showed that it was safe to do. One thing that I always take a step back to is also just talk to your doctor and make sure they're okay with it for any other reason. But hopefully I sounded like Dr. Carter. That was my best impression of you, good sir.
Now I want to ask a question to Dr. G, just to clarify. The study that you said, because what I've read is that your first and second dose should be the same, but your booster can be mixed.
Yes.
Okay.
Sorry. Yes, that is, yes, you're spot on. It's the booster, that additional shot. Yes. Thank you, Dr. Rogers.
Thank you.
Latanya asks, for those who have COVID and recovered, but are left with continued weakness, tiredness, and shortness of breath, what is the prognosis for restoring previously normal capacity?
So I'll tackle this one quickly. And Latanya, my heart goes out to you. I would still emphasize to try to touch base with a physician. He or she may be able to also connect you with a post-COVID clinic, because these symptoms can be, I was describing earlier, it can be one of many three things. I would say overall, generally, if they tend to be from healing, what we've seen on average is around 6 to 8 months, people seem to recover back to normal. If there really seems to be part of this long haul syndrome, then you should talk to one of those providers to see if there's any interventions they would recommend. These symptoms are general. I apologize. For the most part, if they're from healing, usually around 6 to 8 month mark, we do see patients just returning back to normal, but it takes time.
Wow. Well, we're about to wrap up, and I'd like to invite our panelists to give us your closing statements as to what you really want people to come away with from this very impressive webinar that the Diaconate has put together at Metropolitan Baptist Church. And I'll start with Dr. Carter.
Thank you so much. I want people to understand that we as a community we understand this virus now. We know what to do. The science is clear. We know how to get a vaccination. We know how to mitigate the spread. So if we just do our procedures, what we know, and just follow that, and especially if we do it to the point where we can honestly get this virus down to the point where it's what we call in the green zone, where all of the numbers are low, then we can get back to a relative state of being normal, and normal being like what we used to be. But there's still going to be in our minds that we need to be protecting ourselves. And I think one thing that COVID really did well for us, and I want everybody to know, our rate of flu dropped because people were wearing masks, staying away. That really helps mitigate a lot of disease that spreads, especially airborne, period. And that is a very good thing in terms of our health. So I just want people to take away all of the wonderful words that all of the panelists have said. And I want whoever is going to be in church to know that if you come to Dr. Woods' church, taken care of. So thank you so much. I really appreciate being here.
Thank you so much, Dr. Ernest Carter. Dr. Rogers?
Yeah, thank you. So I would just say to vaccinate. That's the first thing that I would say. It's available for anyone 5 years on up. And that COVID, it may not go away in the near future. We're going to continue to hear about COVID, whether it is what we've been talking about for people who were infected and recovered, or people who are dealing with the long-term effects of COVID. Stay healthy, follow up with your primary care doctors or your pediatricians. And if you don't know something, ask. We talked about, misinformation. We don't want you to leave here with any misinformation. And from today, if there's something that you really don't understand and there's something you really want to know, call your doctor and just ask and get some factual information.
Definitely. Definitely. Thank you so much, Dr. Tramaine Davis Rogers.
Thank you.
And Dr. G, should I attempt to say your name again? No.
Oh, you are fine, honestly. I'm gonna say two things. One is the responsibility for this pandemic to end is not Dr. Rogers, it's not Dr. Carter's, it's everyone's. I always say as a doctor, I'm your last line of defense, because if you're seeing me with COVID, we missed the boat. So all of you all who joined today, you're officially part of the front line. You're all responsible for helping us end the pandemic, right? So, learn the science, adapt it to who you are, and make the decisions of how to stop it, from face masking to vaccines. We have the weapons, right? We can turn this into, nothing more than a common cold, but the responsibility must be felt by all of us. So I say this because if you come across people who are like, I don't have the vaccine, all right, fine, flip the script. Just ask them, well, what are you doing to help us end the pandemic? And the second part is actually I commend for as Jacquie and others, Dr. Wood, for allowing us to be here. Because as Dr. Carter said earlier, right, thank you for unmuting and saying this, because you're like, the internet has so much misinformation. You're right, misinformation doesn't take a day off. They're constantly out there. So for others who are part of this congregation, or maybe part of others, invite us, get us out into your communities. Let us come and just talk to you all, because misinformation won't take a day off. We can't either. So let us come to your communities, let us talk, let us put your minds to ease with the information you need to help us end the pandemic. The responsibility is all of ours.
Dr. Panagis Galiatsatos. Was I good?
That's
All
great.
right.
So we'll welcome you to Greece with that. Perfect.
Thank you all so very much. And as Dr. G said, when in doubt, ask your physician, as Dr. Carter and Dr. Rogers pointed out, your physician is key. And there's also the cdc.gov website. That's accurate information on that website that you can always go to. And you all were wonderful, so much information. We only had just a few questions left that we're going to try and answer, and put the answers and the questions up on the Metropolitan Baptist Church website. So please stay tuned for that. I want to tell everyone about how you can take action. If you're not a Metropolitan Baptist Church member, you can get your church involved in this. This is a family and friends are invited to participate in the Conference of National Black Churches Virtual Pastors Training Program for CNBC's Vaccine Education Action Plan. The Black Church, mobilizing African-American communities to overcome vaccine hesitancy, trusted voices, trusted content, trusted spaces. And as you can see, outstanding presenters, Dr. Sharpton, and Dr. Fauci, and Dr. Jones, and Dr. Oyeko. Wonderful event that is for you to participate. And the project is designed to provide extensive education and training to at least 3,000 pastors and faith leaders to equip them to serve as ambassadors, sharing scientifically based, trusted information about vaccines, with special focus on the COVID-19 vaccine and variants. And it's going to take place Thursday, December 9th, 6:30 p.m. to 9 p.m. Eastern, and Saturday, December 11th, 10 a.m. to 12:30 p.m. Eastern Time. And there is a one-time stipend of $500 per church that will be offered to the church of all participants who complete the training. And there's something else that Metropolitan wants you to know about. Metropolitan, your diaconate ministry, wants to help you to protect yourself in this pandemic environment. You can join us for our Metropolitan Cares Family Vaccination Day at Metropolitan on Saturday, December 11th from 10 a.m. to 4 p.m. The Maryland State Health Department will be on site providing vaccinations for adults and children. Remember to bring your ID and your vaccination card if you're getting shot 2 or a booster. This event is open to the public, so please spread the word and come early. Get ready to get protected and to have a little fellowship with Metropolitan Baptist Church. They've got gift cards for the first 50 households represented. And this is Saturday, December the 11th from 10 a.m. until 4 p.m. at Metropolitan, 1200 Mercantile Lane in Largo, Maryland. Once again, go to cdc.gov if you need to get some accurate information. And as I said, the questions that were not answered, we're going to try and answer them and put them on the Metropolitan website. I would like to thank Drew and Servant B.J. Brooks and Reverend Brenda Girton Mitchell and Jonathan Branch for inviting me to moderate this really wonderful webinar with so much vital information and excellent panelists. It's always good to be with my church family, and I send love to each and every member. And I'm going to right now turn it over to Dr. Jesse Woods for his closing remarks. And thank you, Dr. Wood.
Jackie, it's been a joy and a pleasure. We are always excited when you come and share with us. You are so special to us, and the committee could not have chosen a better person to moderate this panel. And we thank you so much for your time and your sacrifice. I want to say just a couple of things in closing, and especially as I speak to the Metropolitan family. One of the things we ask you is to don't measure us by what others are doing, what other churches are doing. I can't speak to when other churches open and how they do it. We're simply doing the best that we can to make sure that we keep everybody safe. That's our aim. Keep everybody safe, to keep everyone well, to keep everyone healthy. I do ask you in the process to be patient with us. All of us, I think, or a greater number of us, are really ready to return to worship. I know our pastor is ready for us to return, and we are as well. But patience is key, because we want to make sure that whatever we do it right. We ask you to continue to be prayerful. Be prayerful for our staff, be prayerful for our pastor, and be prayerful for the leadership of the church, that we are trusting God to continue to guide and provide us with the kind of message and information and discernment that we need to make good decisions. And then lastly, I say we need for you to be encouraging to others. There may be some who are still on the fence, some who are still struggling, some who have some uncertainties. We ask you to be encouraging to others, because you can make the difference. We have one primary mission, whether it's virtual or whether it's in person or a combination of, and that is that mission Christ gave us in Matthew 28, and that is to continue to spread the good news, to continue to bring lost souls to Christ, and continue to open up the door where those who perhaps don't know him have not received him will receive Christ as the Lord and Savior of their lives. Once again, let me thank Dr. Ms. Jacquie Gales Webb for moderating our panel today, Dr. Ernest Carter, Dr. Tramaine Davis Roger, Dr. G. I'm not going to be as bold as Jacquie and try to pronounce his name. And also, as she has already articulated, our thanks to Servant B.J. Brooks, Reverend Brenda Girton Mitchell, and Mrs. Drew Elons. Lastly, I want to certainly thank our pastor, Pastor Maurice Watson, for once again his willingness to trust us in moments like this, and to he's always open to ways in which we can broaden the message and broaden the base. And so we thank him for this opportunity once again to do just that. I'm going to conclude with a word of prayer. And I think that at the end of this prayer, that will be the end of our time together today. Again, we thank God for all that God has done in our presence. Let's pray. Gracious and all-wise God, our Lord and our Savior, the author, the finisher of our faith, the one in whom we live and move and have and have our being. How grateful we are to thee for your wonderful and awesome goodness to us. We thank you for how you've watched over us, how you've kept us through difficult and challenging times, through the ups and downs of life. Some folk have had more ups than downs and some more downs than ups. But in the midst of it all, it's been your hand, your stabilizing hand that has kept us. Thank you for your love. Thank you for your mercy. Thank you for your grace. And then, God, we thank you for those who presented today, though in any kind of way, whether they worked in the background or out front, whatever it may have been. We thank you that you have been able to use them to share good information and spread the good news. Our ultimate aim is that your people will be healthy and your people will be safe and your people indeed will be well. We commend this church family and every listening person into your care. Watch over every home that's represented and every person listening, the sound of my voice, even right now. I ask you now to continue, God, to bless our pastor, our first family, and continue to just infuse us with your presence, with your power, and with your spirit, so that we'll know what to do and when to do it and how to do it. And when it's all said and done, we'll give your name all the praise, all the glory, and all the honor. God, we love you, and we thank you, and we praise you. And we ask all of this in the name that's above every name, in the wonderful name of Jesus, our Lord and Savior, we pray. Amen.
His praises shall continually be in my mouth. No matter what I see or how I feel,